Good morning, welcome to Sports Radio 1310 The Ticket. George DiGianni, Train Station Fitness Show. No, your alarm clock is not wrong. The time is correct. It's 7:51 on the Train Station Fitness Show. What, Dave?
6:51.
6:51. Thank you, Dave. My alarm clock, I guess, is off. It's a new time. Just want to let everyone know it's a new time. We're starting 10 minutes early. We're going out at 7:45. We'll be gone, but it's 6:51. And just keep that note for the future for those of you who get up at 7. And if you've getting up at 7, you're probably not hearing this now, thinking something that's wrong. On the show today is guest Dr. Kevin Light. We're talking about his new book, Outsmart Aging, and what you don't know about cholesterol that you need to know that your doctor may or may not know. And if they know, did they pick up the phone or send you an email and tell you about the new information that you need to know about cholesterol? Because eating cholesterol doesn't create high cholesterol. Outsmart Aging, you buy it at Barnes & Noble, and you also buy it on Amazon.com. Also in the studio, Dr. Jeremy Webster, to tell Dr. Kevin Light whether he's right or wrong and give him a shot in the arm if he needs
true
it.
at all. We know he's right.
Lively debate.
Yeah. So I'm looking to create some controversy this new morning and new time on the show. Good morning, guys. Good to see you.
Good morning.
Good to see you.
So you wrote this book. Why? Is it to set others straight, just people in life, or is it to say, boy, I really hope my colleagues, other DOs, other MDs, pick this up and recognize this is the truth of what we know, opposed to what they continually think is true by big pharma's studies and big boob girls coming out and promoting what they think is true and that you should be guided by.
Yeah, I wrote it for patients because there's so many patients who don't know, and I see a number of people with all these problems, and it's easier for me to just hand them a book and let them go home and access it over and over again. So pretty much for the patient, it's written in a very conversational, easygoing tone. And
you quote studies in there too.
Oh, sure.
Yeah, I mean, because if
it's science, it's not just opinion. It's all science-backed and studies to support it.
So Dr. Jeremy Webster's here.
I am.
And he's got nothing to say. So let's talk about cholesterol. People think by eating cholesterol, it's going to affect their cholesterol. So it's not necessarily going to affect it and make it high, but affect it in general? Like creating an imbalance?
The whole issue of cholesterol is just steeped in myth. And the idea that you can impact your cholesterol by what you eat is one of the bigger myths. Probably less than 8% of your cholesterol comes from your diet, and the majority of cholesterol comes from your liver. You make the cholesterol, and your cholesterol is high because your body's responding to something. Some docs even think that the high cholesterol is an immune response to some sort of insult or some sort of problem. So high cholesterol usually is your body screaming, there's some imbalance. There's some imbalance somewhere, except for the cases where there's a genetic predisposition, some of the genetic diseases. But most of the time, high cholesterol is your body saying something's wrong that you have to address. So, that's where you have to focus your energy versus, well, we'll just put you on a drug to get that number down that doesn't address the problem.
So let's back up for a moment. Some of this information has been publicized over the past 2, maybe 3 years. New information about reading someone's cholesterol. A practitioner reading cholesterol. It's not looking necessarily at ratios anymore, where we thought, okay, you might have a high total number of cholesterol, and then other people will say, well, it's not just a number, it's the ratio of good to bad, or HDL opposed to LDL. Now we're looking at small particles, how many those are above a certain number, above 700, I think you told me, and how big or small they are. And so I have a lot of questions that are surrounding this. Is this like gospel now, the way to look at cholesterol? And
absolutely.
It is.
Absolutely.
And so I suspect doctors who receive this information are not calling their patients or emailing their patients and saying, hey, we looked at your cholesterol last week. Let's say this publication came out and they saw this new information we're discussing now. And we want to retest it, or we want to look at it a little bit differently to either settle your mind and pull you off that drug that you might not need, or put you on one that you might need because of the new way we're looking at it.
Right. You know, old habits are hard to kill.
Sure.
I think more and more doctors are learning this, and it's coming out in the societies and in their papers. So I can't universally say that they're ignoring it. How proactive they are with their patient population in terms of redoing things, it depends on how busy they are. But
isn't that unfortunate what you just said?
that is, you know, some doctors carry 2,000-3,000 patients, and they've got 5 minutes to talk, and they'll catch you next time you go through their office. But if you know, out of sight, out of mind, kind of thing.
So and I know we have more to get into, but how important would it be for a patient, Dr. Webster's patients, your patients, anybody who goes to an internist, they're listening to this information right now, to call their doctor and say, hey, I know I just had my lipid profile tested. Let's test it this new way that we're going to discuss.
That's a great point. That new way is very common, and what that would do is so many people are put on statin drugs just to manage that number,
right?
Which we're finding out it's the particle size and particle number. How many little particles are in the blood that are far more important? And you could take so many people off statins, or you can address the reason the cholesterol is elevated in the first place, or why are the small particles there. That's the most important thing. Get these people off the drugs, because now you have a more comprehensive way of looking at the cholesterol, and it gives you much more information.
And I want to get back to something you said earlier. You mentioned that what you eat, the amount of cholesterol that you eat specifically, doesn't affect your cholesterol levels.
Yes.
In other words, you can eat a lot of egg yolks, and that's not going to make your cholesterol levels spike.
Correct.
But please talk, if you can, I don't know if you're familiar with this or not, but how your diet can, in fact, affect your cholesterol levels. Not the cholesterol that you consume, but the other things that you consume.
Carbohydrates is what you're talking about. If you eat a high carbohydrate diet, it's going to send your triglycerides and your cholesterol through the ceiling. Okay, so one of the dietary things you can do to bring that number down, among other things, is to cut down on carbs, because insulin resistance, insulin sensitivity, pre-diabetic states are big contributors to high cholesterol.
So now we need to make a little bit of a shift within this topic, and that is, recently I had my blood work done by you. You're my hormone specialist, and while my numbers have been good my entire life, looking at my cholesterol now, the supposed quote-unquote or new way, or the definitive way to decide on whether you're healthy or unhealthy, we look at it and we realize, wow, George DiGianni is supposed to be this fitness guy, and his cholesterol is really unhealthy, not because of his overall number, it's because of these particles, and some of the reasons that you and I deduced why that might be. So for people who don't know, I've dealt with some serious business crisis over the last 4 months, and I've been up at 3:30 in the morning beginning my day of work, and I'll work for 17, 18 hours before I go to bed again. And that's been 7 days a week. So when you do that, you're in a stress mode, so stress. What has stress done to me? It's affected my cholesterol, not food, stress has done that. Stress has lowered my testosterone. Oh, by the way, I've been on testosterone replacement therapy for 10 years. That's what stress has done. And while I was out of town, Samantha and I were in New York, and I ate like crap on purpose. Why? Because I'm healthy, because I worked out twice a day, but it didn't matter, because while I was gone, I had a very stressful situation. All of that affected my cholesterol. So for when doctors say, any of us here, or doctors listening, or even if they're not listening, say, you know, if you want to get your cholesterol under wraps, we see that sugar really affects your cholesterol, so stop sugar. That might not be the cause.
Oh, no.
And people need to know that.
It's a number of things. Testosterone deficiency causes high cholesterol.
Testosterone deficiency causes high... Hold on one second.
Yes.
Dr. Kevin Light, who wrote the book Outsmart Aging, just said low testosterone causes high cholesterol or imbalanced cholesterol.
Absolutely.
How can you say that when we see all these ads on TV telling people when you use testosterone replacement therapy, it's going to kill you in 5 seconds?
We can get into another hour-long discussion just on that study itself and all the many flaws in that study. And that's both those studies have been discounted by the professional press.
So isn't it funny how we see these scary supposed studies come out? They scare us, and then you have the ambulance chasers going after those studies and making everybody aware of them who might not have been aware of them. But when they're recanted, or rebutted.
You don't hear anything.
You hear anything about it.
Well, you have thousands of studies that talk about how important testosterone is, testosterone supplementation, in every way, shape, and form. You have 2 that are not even real studies. They're retrospective analysis of old data. 2 studies out of thousands that say, oh no, it's bad, it causes problems. And that's where the spotlights go. You know, the helicopters come in, the lawyers show up, and now it's all over Facebook. But like you said, you discount those 2 studies in the face of thousands that are great, and it just whimpers away like a little shot dog. You know, they just disappear, fade to black, and that's just so typical of the way the media works.
Really, I thought it was interesting what you brought up, talking about stress relating to your cholesterol levels. And when you talk, and then Dr. Light brought up testosterone, and we all start talking about all these different things. The people out there might be really confused. But what I want to point out is that cholesterol is not this bad guy. Cholesterol's been made out to be this horrible, artery clogging, nasty thing that you don't want in your system. And the truth is, it couldn't be any farther from that. Cholesterol is a molecule that's one of the most important molecules in our entire body. We make testosterone out of cholesterol. We make cortisol out of cholesterol. Cortisol is our stress hormone. You wonder why your cholesterol level changes when you're under stress? It's because your stress hormone is literally made out of cholesterol. Cholesterol has anti-inflammatory properties. It has antioxidant properties. It repairs any kind of damage that occurs inside your body. Vitamin D is made out of cholesterol.
That I didn't know.
Vitamin D is made out of cholesterol.
Wow.
When the sun hits your skin, the sunlight does not make vitamin D. The sunlight just simply triggers the cholesterol in your skin to be eventually converted into vitamin D. It's all made out of cholesterol. It's one of the most important molecules. If it wasn't important, it wouldn't be one of the main constituents of breast milk.
Right.
There's tons of cholesterol in mother's milk.
And as Jeremy said, it's cholesterol gone bad. It's cholesterol that gets oxidized.
That would have been a good name for a book. Cholesterol gone bad.
It's cholesterol that turns into small particles that sort of scratch the inside of your blood vessels and start up this chain reaction of events leading to occlusion and heart disease.
Quickly, I want you to point this out. When we test, because we didn't say what that was, what should doctors look for now, and people listening to the show, about these particles, how many they are, the size? Go ahead, and you have about a minute and a half.
You're ideally looking for the number of particles and the size of particles of your LDL, which is typically being called your bad cholesterol.
Right. Not just your LDL number.
No, your LDL number has some influence, but it's the 40% of people who have heart attacks have cholesterol's under 200. 40%.
Under 200.
And
right.
why is that? Because it's the particle count. So you look at whether you have these big fluffy LDL particles floating around like big pieces of popcorn and bumping into nothing, causing no problems, or do you have this little sandy, gritty, irritating cholesterol, LDL cholesterol, that is constantly wearing away and irritating your blood vessels.
And small, and a bunch.
A bunch
so
of small
what's the
ones.
number? I think you told me the number is 700?
700.
So you don't want, just to be clear, we don't want small, little gritty, a bunch, high amounts of the LDL bouncing around.
No.
We want the really big popcorn-like, for the picture that I'm getting from you.
Right.
And less than 700 or up to 700. Mine, for people to know this, is really important recently. I had 1,600 of those
small guys,
small gritty ones bopping around in my body, which is really high. It's more than double the 700, but my total number was healthy.
Amazing.
And so coming up next, I want us to talk about more about that, so people really get that. For people who are just tuning in, my new time is 6:50 a.m. on Saturday mornings. We've been going for about 15 minutes. So coming up next, we'll talk more with Dr. Kevin Light, his new book, Outsmart Aging. You can get it at barnesandnoble.com, amazon.com. Dr. Jeremy Webster's in here, and he's validating everything that I'm saying. How's that? Is that a little better than earlier? Okay, good. So coming up next, 705 Sports Radio 1310, The Ticket. 711 Sports Radio 1310, The Ticket, George DiGianni. New time beginning at 6:50 a.m. from now on. You may want to set your alarms. I'm here next week, but then I'm gone for a month. I'll be back March 7th. I'm going to be in business school, hopefully graduating, and looking forward to coming back and talking with all of you about your health, your fitness, your goals, your life. So on the show with me today is Dr. Jeremy Webster, co-hosting, and also Dr. Kevin Light. Wrote a new book called Outsmart Aging. You can get it at barnesandnoble.com, amazon.com. We were just talking about how stress affects cholesterol. Even though we've talked about cholesterol many times on the show, what's often not either known or appreciated, if it is known and not shared with the masses, is how cholesterol is affected by imbalanced hormones, stress, food, but the cholesterol is not affected by cholesterol. We discussed that in the first 15 minutes of the show. Dr. Webster had a point he wanted to bring up.
Well, we were talking earlier about how your total cholesterol may not be that important of a number. Your LDL and your HDL may not be that important. And Dr. Light brought up the fact that you can now test the size of the particles and the number of the particles and how important that is.
He's a size queen. He said size matters.
Stop
Size
it.
does matter.
Size matters.
And it is important, but I mentioned something during the break, and as soon as I mentioned it, Dr. Light's eyes lit up. He said, yes, 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 bring that up. And what I mentioned was, even if, as we mentioned earlier, even if you have a lot of these small particles that might be the more damaging or dangerous particles, that in and of itself is not necessarily enough to cause heart disease. So if you'd like to elaborate on that.
The small particles are more likely or more vulnerable to damage. So you can have cholesterol, then you can have oxidized or rancid cholesterol, or you can have blood sugar molecules attached to the cholesterol, so it's altered cholesterol. It's the altered cholesterol that likes to pick on the small guys, because the big guys it doesn't affect.
And how do you know? Can you
You
tell?
can measure it.
Well, but what I'm asking is, earlier we said if you have a whole bunch of the little ones that are doing damage and they're over 700, that's not a good sign.
Right.
But how do we know if those ones that are over 700 are the ones that are damaging? Or are they no matter what?
No.
They're not no matter what. If you have a lot of little ones, odds are that the little ones are going to be altered in some way, because that's where the problems are with the small ones. So if you have a bunch of small ones, they're going to be altered probably. But you can measure these directly. You can measure glycated cholesterol.
Was mine measured?
Yours was not.
Was not. Probably a good idea to do it when I get back from school.
If you want to really be complete, absolutely.
Well, absolutely, because we said I have more than double of the little ones floating around, which is really bad. And we talked about all the stress I've had over the last 4 months. Not sleeping well, just crisis that I'm dealing with business, and everything's fine now, thank goodness. But it affected testosterone also, which we're going to get into in a moment. So we don't know how bad.
But we can assume, since you've been stressed, that you've had elevated cortisol levels.
Sure.
Elevated cortisol levels cause elevated blood sugar. Elevated blood sugar is sitting around waiting to pick on small little LDL particles and glycate them. In other words, coat them in sugar, and now you have a problem.
So even if you have a lot of these small little particles floating around, there are things that you can do with lifestyle and diet and nutrition to affect this, right? Because we said
that's the way you do it.
They can't ruin us unless they're oxidized or if they have this sugar product on them. So if you can control your blood sugar and you can eat an antioxidant-rich diet and don't eat a lot of damaging things like trans fats, then even if you tend to have lots of the small particles, they still are unable to do damage.
That's very true, Jeremy. In my practice, if I give them a good diet and they follow it and put them on the right supplements, you turn those small particles into large particles.
Conversely, we've already proven that even if you take the right supplements, you eat really well, that you can still have these damaging particles. I'm living proof of that.
Yes,
I don't eat like crap. Okay, I take all the right supplements for not only for balancing blood sugar, but everything you can take. And mine was through the roof and bad, really bad. Why? Because directly related to chronic stress, chronic inflammation, chronic elevated cortisol levels.
Which goes back to my initial statement that elevated cholesterol generally is a response to some metabolic something somewhere.
Right. And I was
that needs
working
to be
out
looked
twice
at.
a day for a short period of time, but mostly once a day. So, and there was burst training involved, not all the time, but it was involved.
Right.
So, and I still had these issues. People need to know that even if you're doing all the things that are considered the right things, you can still have a heart attack. You still have a stroke. You can still be susceptible to disease.
And the other important message in this whole thing is you can be on the statins and be managed by your doctor, and your numbers are wonderful. Your doctor says you're fine up until you have a heart attack.
Right.
Had they done the right test and did a particle analysis on you and saw where your particles are all over the map and we need to go here to fix you, that's the big message.
All right, so for people listening right now, if you want to call your doctor, get in touch with your doctor and say, look, I know we did a lipid profile or a cholesterol profile. We looked at all my fats, the triglycerides and the like. I'd like for you to do a particle test. If your doctor does not know what that is, probably a good idea to change doctors, because the information they're going to give you is going to be...
Most doctors should know about this.
They should know about it, but do they know how to treat it? Is it going to be a drug?
That's a good question.
Okay, so there's that. Now let's talk about stress, chronic stress, affecting testosterone.
Okay.
We already identified its direct correlation to cholesterol, how it affects testosterone, and then when you take testosterone supplementation, like I've been doing for 10 or so years, what we really need to know about that.
It affects it in two ways.
Yeah.
Like Jeremy said earlier, testosterone, estrogen, vitamin D, all these things are made from cholesterol. Okay? They're all made from cholesterol. And cortisol, which is your stress hormone, is also made from cholesterol. So it's like the mama-daddy hormone, the mama-daddy compound. Now, cholesterol has a choice. Do I go to testosterone or do I go to cortisol to deal with this stress? Okay, if you're in a lot of stress and you're pumping on a lot of cortisol, all of your pumping out a lot of cortisol, all of your cholesterol is going to go to cortisol. It's not going to go to testosterone, and so your testosterone, takes a hit. The other thing is...
Wait, let's define that. Takes a hit means it goes lower.
The low levels get
Therefore,
lower.
you may feel, let's do real world here. You may
Sure.
feel weak, fatigued, need a snap during the day, not as strong in the gym, not motivated to work out, having sleep issues.
Right, irritable, foggy thinking, no sex drive. Conversely, even women, it's the same thing. If women are under constant stress, they're not making estrogen. And so you can flip a woman into menopause because you're under stress.
And guess what estrogen's made out of?
Cholesterol. Isn't that amazing?
Yeah.
So the other thing is, there's called the neuroendocrine theory, which is sort of a fancy word, but basically the elevated cholesterol from chronic stress washes over a part of your brain called the hypothalamus. Just washes over. Finally, the hypothalamus shuts down and says, I'm not playing anymore, and it starts ignoring it and quits sending signals to the pituitary. But it also quits sending signals that drive the thyroid, that drive the testicles, that drive the ovaries. So a lot of your endocrine glands just shut down with chronic stress just because your brain quits talking to them.
All right, so if you're on, so one of the things we noticed, we'll bring it back to me because this is a touch point that people need to be aware of if they're already considered healthy or doing the healthy thing, the right lifestyle thing. And not only have you affected your cholesterol levels from chronic stress, but you can also affect your other hormones, being testosterone, like I talked about. Mine was low. I'm on hormone replacement therapy, and mine was low. So
You're burning it right up.
I'm burning it right up. I'm not even using it. And it doesn't make sense. I put it on all the time. What is another reason it may not be working? This is really important for people to know who are considering going on testosterone replacement therapy or currently on it that I wouldn't have known.
You talking about the skin transfer stuff?
Well, yeah,
Okay.
how it's...
So for example, a lot of people, excuse me, when they're on testosterone, they use creams because it's nice and convenient. Some people, that cream just can't get through the skin. It can't get
through the skin because of the type of cream.
Well,
the compounding, the company.
That's right. So when you go to a regular compounding pharmacy, they'll use their garden variety cream.
And is that the cutting agent? It's not necessarily all testosterone. It's got to be mixed with something.
Testosterone has to be put into some cream so you can lather it on.
Right.
But there's something called a lipodermal cream that is designed to really push any drug you put in it, be it estrogen or testosterone, right into the skin. It has to be requested, and it costs a little more, but not much. But that's one remedy.
So hold on. Let's let people know what that is. The place that I'm getting mine currently, do they use this type of cream?
I'm not sure if they use it at the place you're getting it right now.
All right, but we need to know these things ahead of time.
Yes.
Say that again. If someone's using testosterone, they're putting on a cream, they need to request what?
Lipodermal cream.
Lipodermal cream.
Yes, and usually that would be the physician to do that, not the patient.
Did you do that for me?
I did.
Okay, good.
Whether or not they did it, I'm not sure.
Go ahead.
and then the next route is, if that doesn't work, there's shots. And there's even pellets. There's other ways to get testosterone.
Well, we don't like the pellets.
We don't
so
like
stay away from
pellets.
pellets. But something you said recently, I thought that was really, really interesting.
Oh, the shot stuff.
Yeah.
Well, here's the thing. Traditionally, shots. Who wants to get a shot once a week in the thigh?
Oh.
Not me. I've done it, and I don't look forward to it. It's like going to the dentist. God love the dentist, but still, you can take now a little teeny needle and put a little blip under your skin twice a week, and it works wonderfully. It's called sub-Q testosterone.
Which is really odd
use it
because
personally.
the thought for many, many years, even the bodybuilding community, is you got to get it deep in the muscle. Got to get this really long needle, get it deep in the muscle. That's how it'll work. What you're saying now is you can use something that's just a little bigger than an insulin needle.
Correct.
and you can do it right, subcutaneous, so right underneath the skin and
Right.
get benefit from it. That it completely throws
changes a
everything
lot
off
of things,
from
right?
what the thought has been for, 30 years or so?
Well,
40?
at first they used to do it every 2 weeks. They give you this big whopping shot in the muscle
Almost
of
like the pellets.
testosterone.
They go up, really big spike,
Yeah,
and then...
yeah. So now it's clearly been shown how effective it is. And in my patient population, I put pretty much everyone on the sub-Q shots because it's just so easy.
Right.
The
Well, I don't
doses.
like the sub-Q shots. Like I said, convenience. I don't.
Yeah.
Well, number one, I don't want a needle. I don't care how big it is. Number two, you can't travel with
Size
it, or it's
matters.
more of a pain in the butt to travel with it. But
Yeah.
if we can get this lipodermal
cream.
cream, then we know it's effective. What
Right.
you and I have deduced was not only, George, are you under stress and you're experiencing low testosterone, but it's most likely, since you were familiar with the pharmacy I was using, them not using the high quality cream to
Right.
get the absorption to give me the effect I needed.
Exactly.
Did you know that?
No.
That's pretty cool.
No, I didn't. But I have a question.
Yeah.
We're talking about the relationship between cholesterol and testosterone, and don't answer this if you don't want, but when somebody
Which will
goes
make you
in
look guilty.
and their cholesterol level is 205 and their doctor says, oh, too high, we got to get you on some statins, could potentially knocking your cholesterol levels down with a statin drug affect the way you make testosterone, and that be the underlying cause of low testosterone in men?
Absolutely happens all the time. Because it's going to take away the building blocks that you need to make testosterone or estrogen or any of these things.
Or vitamin
And
D.
so you get, and no vitamin D, so you get this cholesterol number down to, ooh, it's 140. Boy, aren't I in good shape? You're not making any of the good stuff you need.
Right.
So,
Coming up next, there was something else you shared with me recently that a lot of people may or may not be aware of and what they're going to do with it. And how when you turn the age of 40, we're not gender specific, your thyroid is affected at some level. And I thought that was very interesting. Once again, you can do all the right things, but you're dying. From the moment you're born, you're not doing anything but dying, and that's fine.
well, that's cheery.
Hey, we tell you what you need to hear, not
That
what
is
you
a
want to hear.
nice thought.
So, but the point
I
is,
thought Dr. Delighht's book was Outsmart Aging.
Yeah, not outsmart dying.
not smart
okay,
dying.
okay.
No, because you walk in front of a bus. I'm not going to.
Okay.
So, but what's really important is how your thyroid will be affected. So, for those of you who do truly have thyroid issues and you have an abundance of fat, have you done it, number one, to yourself? And number two, if you don't have an abundance of fat, but you just feel sluggish, we'll talk about I want Dr. Webster to talk about the signs and symptoms of imbalanced thyroid, so not necessarily low. But Dr. Light shared with me that you're affected from 40 years old on with lower or thyroid imbalance, and how we can treat that, but not in a way that your body doesn't recognize it, in a way that it does recognize it and benefit you, and it's not going to hurt you. And I thought that was real interesting. So we'll talk about what that is coming up next. 725 Sports Radio 1310 The Ticket. 731 Sports Radio 1310 The Ticket. George DiGianni Train Station Fitness Show. New time, 6:50 a.m. to 7:45. So this is the last segment of the day. We're finished at 7:45. No crosstalk. Just let everybody know that is the new station requirements. So we'll be on next week. Dr. Webster will be with me again as a co-host. So will Mo Grosset as a co-host. What are we talking about next week?
I guess we'll talk about the difference between prevention and early detection.
But that's boring.
No, it's not.
Tell us why, though.
Well,
we discussed this earlier.
Well, okay, for example, if a woman goes in and she thinks she's doing something to prevent breast cancer, and so she gets a mammogram, that mammogram's not preventing anything. It could, in fact, even be elevating her risk of developing breast cancer. All they're doing is actually just trying to detect it earlier, which is not bad in and of itself, but people need to know if you want to prevent something from happening, just simply detecting it early is not necessarily the way to go.
So early detection opposed to prevention are just not the same.
Right, and it won't
Right.
be just breast cancer. It's going to be about a lot of different things.
Okay, we
Prevention
might
of
even have
lot
a
of problems.
call-in show next week also with both you and Mo. Right now, Dr. Kevin Light's on the show. He wrote a new book. It's on Amazon.com. It's also on BarnesandNoble.com. Outsmart Aging, Harness the Power of Anti-Aging Medicine, Dr. Kevin Light. And so thyroid is affected regardless of how healthy or unhealthy you are. There's just different levels because everything's relative by the age of 40 and then on. You
wouldn't-
are 50 what?
58.
58, and you're on thyroid
Yes.
replacement therapy. What's really good about that you shared with me really recently is it's from pigs. It's the porcine.
Right.
And so it's most identified with our body as well, and it accepts it rather than rejecting it like a synthetic medication.
Almost
that we're on.
identical to ours.
Almost identical.
People might think
Almost
that's
identical.
kind of gross, but it's either from an animal
Right.
or from a chemistry lab.
Sure.
What would you rather have in your body?
And the nice thing about the porcine thyroid is what everybody knows that thyroid is, there's two flavors, T3 and T4. But you also make T1, T2, and all these other things they haven't identified yet. And that's also in the thyroid porcine that you take that comes from a pig source. So you have these unknown things that come as a package, and they all sort of interrelate and help each other work, versus just a straight up synthetic synthroid, which is just straight up T4.
So this is on the same, along the same lines of some of the talks I've given about supplements, supplementation. How some people, we've not identified every single nutrient in a piece of fruit.
Right.
We've just not done it. So it's impossible for these people who make these cheap supplements to say, here's your vitamin C for the day, here's your vitamin whatever for the day, as if you ate an apple or a banana or whatever, or here's your potassium for the day, when if you've identified, let's say, 1,000 nutrients in one piece of fruit or a vegetable, let's just be extreme for a moment, we are still not aware of what we don't know that's in there that affects all those other nutrients. And just like you said, when it comes to hormones, we've not identified the other parts of that hormone. So if we try to replace one part of the hormone, what about the substrative events that happen with all the other pieces of the hormone? If we put that hormone from the one that's most identified with us, the being the porcine, the pig, into us, it already has that complete component. We're not trying to take an isolated version of it. Logically, that makes sense.
And what's interesting is when you look at the studies, there's some people who, for whatever reason, won't take pig anything. And so they just want the synthetic. So you can make a pig-like product that's just synthetic T3 and synthetic T4 in the same proportion as the pig thyroid. And the patients don't do as well because it doesn't have all those unknown goodies that
Right.
we were just talking about,
Right.
which are critical.
Interesting.
And it's real important that we do. Now, you're over 4. Are you 40? You're 42?
I'm 39.
You're 39.
39.
And there's nothing magic about 40. I want to clarify that.
Hey,
It's not
your
a-
book says.
No, my book says it's not a guarantee that after 40 you're going to go down the thyroid road. But most people, if they start having thyroid problems, usually it starts to rear its head around 40 for some reason.
It's an average.
For some
But
reason.
some people it's a lot earlier.
And then some people it's in their 20s. But in general, it's the 40-year-old female in general that you'll see. Now, does that mean you need thyroid all the time? No, you might just need some selenium or some zinc or some iodine.
Or how about
Or-
this? This is novel. How about clean your diet up and begin to exercise regularly and see if that
Oh,
helps?
yeah.
And then you can identify with how much to put someone on, opposed to putting somebody on whatever the hormone is. That's why I'm not being specific with it, and expecting that to change your entire life.
Right. Well, that's an unrealistic expectation, right?
So Webster, will you, at some point, let's say you're 45, will you use hormone replacement therapy, whether it be thyroid or testosterone or anything else that you might need for yourself?
Only if I required it.
Well, that's my
only
point.
Only if I can't fix my body naturally.
That's my point.
To the point where I can make optimal levels
Right.
without it.
Good.
If I can't,
So you would.
then I would replace.
Good for
And
you.
it's interesting the difference between the way Webster approaches things and the way I approach things. It depends on what tools and hammers you have. So for me, I would be more inclined to, first I would do the simple stuff, but I would be quicker to pull the hormone trigger because that's where I live and what I do, and I see the power of it. But versus someone who's more holistic, I guess, and more fundamental, how far down the rabbit hole do you want to go? How many supplements do you want to take? What kind of lifestyle changes you want to make to make that change, which is harder to do, but you can do it. And so it just depends on your philosophy of things. And
Part of my philosophy is if you're an A-type personality like I am, you're more inclined to rapidly use nutrients from your supplements and rapidly use those nutrients from foods where they're not going to benefit you as much as someone who's not an A-type personality. Therefore, you might need some type of enhancement or more support, rather, not enhancement, more support, because you're rapidly using these things. So when you're under a lot of stress or chronic stress, the supplements you're taking are a crutch. They're not helping you enough because you need more support. What is my more support? My more support is doing something to manage my cortisol levels, doing something to manage my testosterone, because even though I'm exercising and doing burst training, even though I'm taking the right supplements and eating well, it's still not able to give me what I need. Oh, by the way, it just so happened you and I believe, more you than me now that I'm on board, that the type of cream that was being used to administer the testosterone wasn't effective. So it's multifactorial. People need to know that. It's not eat this food, take this supplement, do this, don't do this. It's so multifactorial.
And even when you look at the thyroid is not as simple as either you make enough or you don't. It's not like that. There are lots and lots of different reasons why someone could have low thyroid. Some of them I've found are extremely easy to treat nutritionally.
Right.
Others, forget it. You might be able to do some things if you're perfect for a year or two and get some results. But if you have like an autoimmune disease called Hashimoto's, yes, I can work with you. We can calm it all down. But those are the people that I'd say you probably need to start thinking about going to Dr. Light to get hormone replacement. On the other hand, if it's just a simple iodine or selenium deficiency, well, take some iodine and selenium and your thyroid will perk right back up.
So now that's interesting you say that. You and I worked together. This is not a blame. You just didn't know. My thyroid was low at one point a while ago, 6 years ago. Let's say I'll make that up. And I took iodine. All of a sudden, my next 3 tests were over a year and a half because of every 6 months. My iodine levels were too high. But my thyroid wasn't where it needed to be. Although it was in the healthy range, it wasn't where it needed to be. So I stopped taking iodine because it was just too high. Now taking the porcine thyroid, everything's balanced. Because mine wasn't an iodine deficiency, mine was like you just said. That proves it. That sometimes you may need more iodine, and if that's not it, back off of it. It's not what you need, because some doctors poo-poo iodine, say, hold on, you start getting that big goiter, that's a BS study also that you commented on years ago.
Yeah, and I don't recommend anyone go out there and take iodine at all by themselves. You need to get tested to make sure that you don't have this autoimmune thyroid problem. Otherwise, iodine can make that worse.
Sure.
But if you don't have that, it's safe to try it.
What are some of the symptoms of low thyroid?
Sluggish. Yeah, low thyroid, hypothyroid just means that your metabolism is working slow, so you're going to be sluggish mentally and physically, cold hands, cold feet because of poor circulation, dry hair, dry nails, dry skin, weight gain, obviously, things like that. And there are more decreased immunity, so you might get sick a little bit more often. Basically, everything in your body is functioning at a lower level, so it can be very diverse.
And what's really interesting, to really make this more complicated, you can have completely normal thyroid studies, and you behave as if you're hypothyroid because you don't have enough receptors in your cells to sit there and receive the thyroid hormone when it comes by. So there's some conditions where the cell, maybe it's supposed to have 1,000 little doors that thyroid hormone can go through, maybe it has 6, and no matter what you give, the cells don't use it, so you're clinically hypothyroid with tons of.
In other words, you
thyroid
feel like you have hypothyroid.
Right. You have all the symptoms you talked about.
Hormones circulating in your body might seem
and everybody's scratching their head, going, "What's going on with this?"
I think from being a listener right now, if I'm just a listener, the most important message, the most important takeaway from today's show for me is, if your doctor says your blood work is fine, but you don't feel fine.
Exactly.
Your doctor is wrong. And you need to go to an integrative medicine doctor.
We don't
Dr. Jeremy Webster, yourself.
We don't take an engineering approach to medicine, okay? It's not getting the number within this certain tolerance.
No, we do take the engineering approach. We shouldn't.
We shouldn't.
Right.
And so the bottom line is, like you said, how do you feel?
Results don't lie.
You know, your numbers can give you a clue, but it's all about how do you feel?
Conversely, what if you feel really good? This is a tricky one. What if you feel really good? You have great energy, you're sleeping well, everything's great in your life, la 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 la, and your doctor says, well, hold on. Let's go back to cholesterol for a moment. Your cholesterol number is too high. It's not 140, it's 205. You know, but you feel great. And then you're put on something. Now all of a sudden you're causing damage.
Yeah. I somewhat disagree with what you're saying, though, because you might feel bad. You might start on a therapy and not feel great initially, but it might take more time. You need to listen to your doctor. If they say it's going to take 3 months or 6 months to fix something, don't expect to feel better 2 or 3 weeks later. You have to stick with the therapy, especially if the doctor knows what he's doing. He tells you up front, this is not a quick fix. This is a long-term fix. sometimes you can't rely just on symptoms. You can't start taking something and say, wow, that made me feel great, therefore it's working, or it didn't make me feel great right away, therefore it's not working. It's not quite as simple.
So that's good. So let me say, instead of saying blanketing it, let me be specific and say what I just said is very true. That you may have healthy cholesterol, even though your doctor might say it's out of the range of what they've learned, not Dr. Kevin Light, okay? You may be healthy. You may feel great and be put on something that's causing damage and you don't need it.
I agree with that.
But you're right also, and I shouldn't have blanketed it.
Here's another example, probably a better example.
Fast.
Testosterone. Okay, so everybody says, I want my testosterone level at 900. And that's the ideal number that we try to go for or 1,000. You come in, George, and your testosterone level is 475, and you feel like $1 million.
Right.
Am I going to give you testosterone? Nope.
If you just want to make money, you will, because I will tell you that the
Kevin
doctor
Light's
I
not
used,
going to do it.
right? But if the doctor I used before you, some idiot, and I say idiot because you have a lot of these doctors that one day they're an anesthesiologist and the next day they're a hormone therapy specialist because they went to a few courses. No, you're not. I learned that the hard way because he wanted mine at 900 or 1,000. And I wasn't sleeping, I was irritable, and I thought I was healthy because I didn't know what I didn't know.
Right.
Now being in that 600, 700 range, not at this moment, but when I was with you and both Dr. Webster over the time, I am healthy, I sleep well, I'm not irritable, I feel great.
Yeah.
And so you've got to listen to your body. We have to go, but just want to let you know, like I've said so many times, your body is constantly speaking to you in symptoms. Doesn't speak English, it speaks in symptoms. If you're not listening to it, it will speak louder, and you're not going to like louder. Next week's show, remember one at 6:50 a.m. starting. Dr. Jeremy Webster, Mo will be with us. Get Dr. Light's new book, Outsmart Aging, Amazon.com, BarnesandNoble.com. Thank you for being here, guys.
Thank you.
Have a great day.